together. All three of us. My daughter was small. She was in grade 1 then. And my package was good. So because
இனிய காலை வணக்கம். A lovely good morning to one and all present here. We're going to start this event. First of all, I would like to welcome Miss Merlin Gopi. So, where in Tamil Nadu is the brainchild of Miss Merlin Gopi. They have started this women association just in the month of March 2022. It's just been 6 months, but they have done a wonderful, really commendable job over this period of time. So, she have created a huge impact about among the women community, especially the women who are from Tamil Nadu. So ரொம்ப பெருமையா நான் வந்து இப்ப மர்லனை அட்ரஸ் பண்றதுக்கு நான் இங்க கூப்பிடுறேன். ப்ளீஸ் மர்லன்.
Thank you, Pavitra. Dear ladies, volunteers, guests, doctors, good morning everyone and welcome, vanakkam, namaskaram. I would first like to thank you all for joining us today in honor of Breast Cancer Awareness Month in Aster Hospital, Sharjah. I want to thank behalf of WIT, Ladies Association in Aster Hospital, for supporting us to educate the young women about this disease. Special thanks to Mr. Jalil sir for your support and motivation, perfect arrangements for this Pink Drive campaign. Also, we would like to honor our valuable guest today, behalf of WIT wherein Tamil Nadu. First, I would like to invite Mr. Jalil sir, Head of CSR, Aster DM Healthcare, and Ms. Abhinaya to honor him. Chief Operating Officer Mr. Gaurav Kurana, Dr. Varsha Rangaraj, Aster Hospital, Sharjah. Please come, ma'am. I would like Aditya to honor her. Dr. Ankita Kumar, Special Radiologist, Aster Hospital, Sharjah. I would like Asha Thomas to honor her. Dr. Siva Prakash Ratnaswamy, consultant. Okay. Dr. Danu Sandradas, specialist gynec, Aster Hospital, Sharjah. I would like Indumati Sendil Kumar to honor her. Of course, we should not forget to honor Global Media Hub Manager, Managing Director Mr. Suresh for supporting WIT wherein Tamil Nadu for all the arrangements. I would like Mr. Suresh to come and Pratibha Shankar to honor her. We must continue to spread awareness of breast cancer during Pink Drive, and after we must take now and again. And okay. Doctor? Okay, Dr. Geeta, please come, ma'am. Sorry. She is the General Surgeon of Aster Hospital, Sharjah. Okay, we are waiting for Mr. Gaurav sir. Meanwhile, we can continue our program. Yeah, I am going to hand over the mic today, and Miss Radha. She is our WIT wherein Tamil Nadu member. She is going to do the anchoring and she is going to have the stage.
Before Ms. Radha gonna take it forward, there is one video presentation about Aster volunteers. So can we just see that now? இது ஜஸ்ட் ஒரு ஆரம்பம் தான். இன்னும் நம்மளுக்கு இன்னும் நிறையா இருக்குது. நாங்கள் இன்னும் நிறையா we are looking forward to it. So yeah, வீடியோ பார்த்தாச்சு. Panelists, doctors எல்லாம் ready. Audience நீங்கள் ready. So yeah, let's start the webinar now. So I'll just give the mic to Radha who can take it forward.
Hi, good morning to all. Now Dr. Varsha Rangarajan, specialist in obs and gynecologist. She is in Aster Hospital and she is going to talk about the importance of pre-screening for preventive care. Thank you, doctor. She is an expert in normal and high-risk pregnancy and fertility enhancing through laparoscopic surgeries. Let us have some small AV.
My first slide, please. So good morning, everyone. Good morning, our dear audience from Tamil WIT. We're in Tamil Nadu, right? Very unique name. So a very good choice of name for this group. And I'm happy to see so many of you here today. எனக்கும் எங்கேயோ தமிழ் லைனும் தமிழ் ஹிஸ்ட்ரி இருக்குது, கொஞ்சம் தமிழும் பேச வரும், தமிழ் தெரியும். அதனால் ஐம் ஹாப்பி தட் இத்தனை தமிழியன்ஸ் இங்கே இருக்குன்னு எனக்கு தெரியாதா இருந்தது. ஸோ இந்த ஹாலில் இத்தனை பேரை பார்க்கவும் ரொம்ப சந்தோஷமாக இருக்குது. நம்ம வீட்டில் இருந்து பேசுகிற மாதிரியே இருக்குது. ஸோ வெல்கம் ஒன்ஸ் அகேன் டு ஆஸ்டர் ஹாஸ்பிட்டல் ஷார்ஜா. And my topic today is going to be about breast cancer awareness. So இந்த அக்டோபர் மந்த்து தான் பிரஸ்ட் கேன்சர் அவேர்னஸ் மந்த்னு சூஸ் பண்ணியிருக்காங்க. எதுக்குன்னு தெரியுமா உங்களுக்கு? தெரியாதா? பிகாஸ் ஆல் அதர் மந்த்ஸ் were taken most probably, இல்லையா? அண்ட் ஸோ இங்கே எல்லோரும் பிங்க் போட்டுட்டு வந்திருக்காங்க. யூ நோ வை பிங்க் இஸ் த கலர் ஃபார் பிரஸ்ட் கேன்சர் அவேர்னஸ்? தெரியல? ஸோ அதுவும் ரேண்டம்லி எல்லா கலர்ஸும் சூஸ் ஆகி ஹெச்ஐவிக்கு ரெட் எல்லாம் சூஸ் பண்ண பிறகு அவங்களுக்கு பிங்க் தான் ஒரு ஆப்ஷனாக இருந்தது. ப்ளஸ் நம்ம பார்த்தா ஃபீமேல்ஸ்க்கு தான் ஜாஸ்தி பிரஸ்ட் கேன்சர் வருது. ஸோ டஸ் தட் மீன் மென் டோன்ட் கெட் பிரஸ்ட் கேன்சர் ஆர் டோன்ட் சஃபர் ஃப்ரம் பிரஸ்ட் கேன்சர்? Breast cancer can affect men also, but less than 1% of the population. So breast cancer is not exclusively a women's disease, but 99% it affects women. So adunala awareness about breast cancer is very, very important. ஸோ நான் இன்றைக்கி என்ன பேசணும்னு நினைக்கிறேன்னா, அங்கே ஸ்லைட்ஸ் போயிட்டு இருக்கு, அது தெரியல எனக்கு. ஸோ மெயின்லி நீங்கள் என்ன பண்ணணுன்னா, இந்த டாப்பிக்கில் இங்கே நான் இருக்கிறேன், ரேடியாலஜிஸ்ட் இருக்கிறாங்க, சர்ஜன் மேடம் இருக்கிறாங்க, அவங்க எல்லோரும் அவங்கது என்ன ஹைலைட் பண்ணுறாங்கன்னு கேளுங்க. என் சைட்லேருந்து எனக்கு மெயினாக சொல்ல வேண்டியது என்னென்னா, நீங்கள் எல்லா மந்த்தும் செல்ஃப் breast எக்ஸாமினேஷன் பண்ணணும். அது ரொம்ப இம்பார்ட்டண்ட். ஸோ நீங்கள் இப்போவுமே பண்ணிட்டு இருக்கிறீங்களா எப்படி? No. All right. So how many of you are aware about self breast examination? How many of you are doing it every month? Nobody. Okay. So breast examination takes only 5 minutes of your time every month, and it is something that you need to do for yourself and even advise your family members, colleagues, other female friends about it. So I wanted to focus mainly on self breast examination because this is one disease where early detection can save lives. ஸோ இந்த ஒரு கேன்சர் தான் இருக்குது. தெரிஞ்ச உடனே நீங்கள் டாக்டர்கிட்ட வந்தாச்சுன்னா அவங்களுக்கு என்னாவது ட்ரீட்மெண்ட் பண்ணி 99% அவங்களுக்கு க்யூர் ரேட் தர முடியும். ஸோ இந்த அவேர்னஸ் நமக்கு இருக்குன்னா யூ கேன் பை யோர் செல்ஃப் notice that you have any changes, any clinical symptoms, any lump in your breast, come to the doctor at once. அது இல்லாமல் if you are 45 and above, regular breast cancer screening னு சொல்லிட்டு இருக்கு, where you come to the doctor who will examine you and guide you for further investigations like ultrasound breast or mammogram. ஸோ ultrasound breast to mammogram என்னென்னு சொன்னால் இவங்க அதை பற்றி எக்ஸ்பிளைன் பண்ணுவாங்க. நான் breast cancer self breast examination detailed slides videos எல்லாம் பண்ணியிருக்கிறேன். ஆனால் நீங்கள் இந்த ஆடியன்ஸில் கம்ஃபர்டபுளாக இருப்பீங்கன்னு எனக்கு தெரியலை. So maybe another time, another talk, we can talk about in detail. But just ஒரு 5 minutes, up to down, right to left, எங்கே எந்த எல்லா சைடில் இருந்து பார்த்து, not only by looking, by inspecting பண்ணி பால்பேட்டும் பண்ணி அங்கே என்னது மாசு இருந்தால் டாக்டர்கிட்ட வருதா உங்கள் ரெஸ்பான்சிபிலிட்டி. All right? Okay. And do you know why you are all wearing the pink ribbon? No? So it is a pink ribbon was initiated as a pink ribbon project many years ago in 1990, early 1990, when one of the sisters of Sandra, her name was Betty, who died from breast cancer. So she was a breast cancer, unfortunately she died from breast cancer, and her sister took up the responsibility to distribute pink ribbons as an awareness and to create and to inspire others to investigate and to bring up some treatment modalities that can treat breast cancer. So this campaign is not only to create awareness but also to ask the brains and the scientists in the world to come up with treatment modalities that can cure cancer. So we need all of you to support this cause. All of us should be aware, and by helping each other, we can fight this. Thank you very much.
Full talk. நிறையா சொன்னீங்க 45 இயர்ஸ்க்கு மேலே ரெகுலராக ஸ்க்ரீனிங் எடுக்கணும். ஸோ அதை எப்படி அவங்களே செல்ஃபாக பண்ணிக்கணும்னு சொல்லிட்டு தேங்க்யூ ஸோ மச்.
Thank you, Dr. Varsha. We would like to honor Mr. Gaurav Hurana, Chief Operating Officer, Aster Hospital, Sharjah, behalf of WIT in Tamil Nadu. And I would like to invite Kalaivani to honor him. Thank you, sir.
Next, we are going to call Dr. Ankita Kumari, specialist in radiology in Aster Hospital, Sharjah. She is having overall 7 years experience in this field of radiology, and she is going to explain about guidelines for breast cancer screening.
Good morning, everyone. Yeah, so today my topic is imaging guideline for the breast cancers screening. So what you need to know. So breast cancer is the most common cancer in the women in the world, and it is the second leading cause of death in the women. And it is a 1 in the 8 of the women diagnosed with the breast cancer in their lifetime. And even in the pregnancy, 1 in the 3,000 pregnant women have a breast cancer. And in India, mostly the breast cancer is diagnosed 60% of the cases in the advanced stage. So what the meaning of the screening? Screening means to find the disease before the symptoms begins. Means we have no symptoms, no any lump, any breast discharge, any pain, any symptoms in the breast, and before that we have to find out that any breast cancer is there or not. So goal of the screening is to detect the disease before its earliest stage and in the treatable stage. So we can treat in the earliest. And so the breast examination, what are these things? Like Dr. Varsha said, self-examination every month. Then the clinical examination by the doctors, like a gynecologist. They can check that clinically that you have any lump, anything is there or not. Then the imaging modalities, that it's a mammogram, that one is the low dose X-ray, and it is the primary screening modality for the breast cancer screening. And then the next is the ultrasound. It is a non-invasive imaging modality. So with that also we can detect the disease. And the last is the MRI. That one we can use in the high-risk patients. So guideline for the breast cancer screening is, it should be start at 40 years of the age. So 40 years of age, it's recommended that we go for the mammogram annually. Means once in a year, we go for the mammogram, and it's a mammogram advised till the 75 years of the age. It's not that we stop in the 75 years of age, but it depends upon what are your comorbidities or life expectancy. So at the 30 year of age, we have to ensure that go for the checkup and see that we are on the high risk or not. And then 40 years of age, we have to start the annual mammograph. And it extends up to the 75 years of age. So who are the high risk patient? High risk patient is who have a known case of BRCA1 or BRCA2 gene mutation, or who have a first degree relative who have a previous breast cancer, like mother, sister, brother, anyone, and who have a radiation therapy in the chest for the 10 to 30 years of the age, or who have a previous breast cancer history. In that case, next. In that case, it's recommended that the annual MRI is go through that at 25 years to 30 years of the age. But sometimes that patient is not willing for the MRI. On that case, we can go for the mammogram with the ultrasound also. And ultrasound we use generally that in the breast cancer cases, which is a high risk but unable to go for the MR exam, or have a pregnant patient, or who have a very dense breast. In that cases, mammogram with ultrasound is detect more the cancer cases. So these are the guidelines, and so according to that, mammogram is annually we have to do, like every years one mammogram have to do, starting from the 40 years of the age. So early detection save lives. This is the motto of this breast cancer awareness program, and this month is the breast cancer awareness month also. Thank you.
Thank you, doctor. எப்பப்பெல்லாம் மேமோகிராம் எடுக்கணும் எல்லாமே ரொம்ப கிளியராக சொன்னீங்க. Thank you so much. We will have a small AV about her. Next, we will call upon Dr. Geeta Kardat Arpai, Specialist General Surgery, Medcare Specialty Hospital, Sharjah. She is going to talk about surgical management. Dr. Pai has extensive work experience as a surgeon and also as a professor. She performs wide variety of surgical procedures, including breast cancer surgeries and laparoscopic surgeries. Please, doctor.
Good morning, everyone, and vanakkam. I'm from Bangalore, so I understand Tamil, Malayalam, Telugu completely, but when I speak, I mix up all three languages. So, I'm going to talk in English. So, a very lovely morning to see all of you in lovely pink dresses, including Mr. Jalil sir, who has supported us by wearing a pink shirt. A big round of applause for Mr. Jalil, who is supporting the cause by wearing a pink shirt. And actually, I'm a specialist general surgeon and a breast surgeon working in Medcare Hospital, Sharjah, which comes under the wing of Aster Hospitals. It is the premium hospital of the Aster Hospital. I'm yet to start visiting Aster Hospital, Sharjah. So, welcome to all of you. Today I'm going to speak little about the, starting from the beginning, how we should be aware and why the pink month is celebrated. All of you are aware by now that my previous friends spoke about the screening as well as what age it has to be started. I just want to highlight on few things. Starting from the beginning. See, why do we do the screening? The Breast Screening Awareness Month is celebrated to save lives. Why? How it can save the lives? You may ask me how a Breast Screening Awareness Month can save lives. How it saves lives? Because when you detect the cancer, when it is in stage 1, the survival rate is 98.5%, or I can say 99%. Whereas, if it is detected in stage 4, the survival rate comes down to 28%. So, the 5-year survival rate. So, this clearly makes you understand the importance of the breast cancer screening programs, which is held throughout the world in the month of October, and that's why it's called as Pink Month. So, when the tumor is less than 2 centimeter, the survival rate is 98%. When the tumor becomes big, lump becomes big, when it spreads to the skin, it becomes 28%. So, this is also for all the gentlemen who have seated here. Please take your wife, at least inform your sisters and tell your daughters to go for breast screening so that you may be saving lives. And how do we start the breast screening? So the breast screening should be started as early as at the age of 25 years, because the environmental influences are so bad. I'm seeing a case. Just last week I diagnosed a lady as young as 29 years of age with breast cancer stage 3. So please tell your daughters to start examining themselves as early as at the age of 25 years. How it can be started at 25? By self-breast examination, which my friend already informed you. It has to be done between 8th to 10th day of your menstrual cycle. For example, if the first day of bleeding is the first day, day 1, count 8 day, and either you do on 8th day or 9th day or 10th day. No point in doing throughout the month. Patients keep telling me, I'm just sharing my experiences with you. They tell that, doctor, we examine every day when we are taking a shower. It's not the right way. Taking a shower, examining, you will not make out anything. It's as good as not doing. It has to be done only once a month in a proper way, spending at least 5 to 10 minutes purely dedicated for breast examination. Like when you're taking, this has to be done between 8th to 10th, either 8th day or 9th day or 10th day of the cycle. Why? Because this is the time when your breasts are soft. It is not under the influence of hormones. Once your cycle comes, the mid-cycle, the hormones start, the breasts become lumpy. So you feel that, And the patients tell me, doctor, I feel my breast is full of lumps. It's called lumpiness, which is caused by the hormones. So I don't want you people to get confused with the lumpiness so that you miss a lump. So it has to be done between 8th to 10th day, only once a month. And it has to be done in both sitting and lying down posture, with the palm of the hand as well as the fingertips. Maybe you can Google for self-breast examination, where the pictures will come, where you have to examine the 6 quadrants of the breast. Outer upper, outer lower, inner upper, inner lower, and then the central quadrant and the armpits. So the left hand for the right breast and right hand for the left breast. So this can be started as early as 25 years. Then what is the next screening methodology? That is the ultrasound examination of the breast, which we start. It's a simple examination, no radiation. It's just like what we do for obstetrics and gynec pregnancy ultrasound. Very, very safe, no risk of radiation. It's very non-invasive. There's no harm caused to you. So every year you can go for a ultrasound examination of the breast, especially in pink month, where all hospitals, including our Aster Hospital, Sharjah, and Medcare Hospital, Sharjah, we are having the promotions, where we are doing in a very nice, we are giving nearly 1/3 of the price package for the consultation and the screening examinations. And then after 40, we start the mammogram examination. Again, the frequently asked question by my patients is, can we do the mammogram every year? So I usually, even though the protocol says it is every year, but what, evidence-based medicine means, we have evidence where we say that every 2 years, every 2 years or every 3 years, in those patients without history of family breast cancer. If maternal side, mother or mother or sisters are diagnosed with breast cancer, it's must to do mammogram every year. Otherwise, if you don't have a family history of breast cancer, it can be done every 2 or every 3 years, but every 2 years should be the ideal frame. And and in those patients with a family history of breast cancer, usually there is an entity called BRCA1. You would have heard of BRCA1, BRCA2. There is BRCA1 and BRCA2 genes, which cause the cancer to affect very young ladies as early as age of 30 years. So the screening for BRCA is done whenever there is family history of multiple cancers like ovarian cancer, colon cancer, and breast cancer. If you have a family history of all these cancers running in different members of the family, especially the maternal side, please bring it to the notice of your treating doctor when you go for screening, so that we will do the additional test, not just the normal screening. And can you tell me who is a famous celebrity who was BRCA positive, BRCA1 positive? Anyone? Any gentleman here? Yes? Yes. Angelina Jolie was found to be BRCA1, BRCA2 positive, and she did a bilateral mastectomy. She removed both her breasts and put the implants, and then she also removed her ovaries. But we are common people. We are not celebrities. So we don't do such extensive things. So BRCA testing will put additional stress on you. If there is a family history, just keep a watch by routine screening. Even if BRCA1 becomes positive, for a person with a family history of breast cancer, no need to panic, no need to worry. Just keep on screening, because the chances are 30 to 40% compared to general population, which varies between up to 8%. General population 8% is the incidence, whereas for BRCA1 we can say 30-40% if they have a family history of breast cancer in a very early age group with BRCA positivity. So the symptoms, there will be a lump, but okay, I'll tell you in the end my take-home message to you so that you don't get panicky. Breast lump is always thought to be a cancerous one unless until proved otherwise. So, but at the same time, when you feel a lump, don't panic, don't Google for breast cancer. Come running to a breast surgeon crying, and this is my experience. I have come across at least in 1 month 3 or 4 ladies who don't sleep the previous night because they have found a lump by themselves, and they Google everything about breast cancer, and they come to me in the early morning without sleep crying. I said, no, that is not at all a panicking symptom or panicking disease. Breast cancer is 100% curable, provided you find it out at the earliest. And so one is lump, and the other symptom can be nipple discharge, especially the bleeding from both the nipples, which is single nipple. Both the nipple is again a benign condition. If something is involving a single breast, bloody discharge from a single nipple again goes in favor of a breast cancer, and it's a painless lump. See, I think majority of the ladies, I can say 70 to 80% of the ladies have a premenstrual engorgement of the breast, where you have a heaviness in the breast, sometimes severe pain, which is almost, we can put it for like dysmenorrhea symptom, where you have severe pain during cycles. This pain starts 1 week before the cycle, and when you examine your breast, you feel you have a big hard lump in the upper outer quadrant of the breast, which is again not to panic, it is just a hormonal influence, and this is caused by again lifestyle has an importance. Lifestyle, with a bad lifestyle, I think all of you are aware of healthy lifestyle, right? I think every day we get WhatsApp message how to go for a healthy lifestyle, eat healthy, exercise daily. Of course, 100% this is protective for breast cancer. Breast cancer incidence is increased in obesity, in smoking, in alcohol intake and lack of physical activity, and increased intake of saturated fatty acids, where our fast food is full of the saturated fatty food. So lifestyle. This is important for breast cancer prevention. And vitamin D levels. Vitamin D levels should be maintained in the normal range. I was also, actually it's a new information for me, even I was not aware. Just recently, from 5 years, they have seen an increased incidence of breast cancer with vitamin D deficiency, and vitamin D deficiency also leads to the symptom of benign breast disease, that is premenstrual breast pain. Then coming to the surgical treatment, I think the radiological, I have to allow other doctors to speak also. And coming to the screening methodology, which my friend already discussed, like the ultrasound, mammogram, MRI of the breast. Indication for MRI, when you are less than 40 years and your ultrasound is not able to clearly say what is your lump. That is when we go for MRI. And those with BRCA positivity and with a history, family history, less than 40 years, we go for MRI. I'm just answering the questions which I answer my patients daily. These are the questions asked by them. Of course, maybe later if we have time, individual questions I will take, and personally you can come and meet me and I will clear your doubts. My topic, surgical treatment. Surgical treatment, so don't be panicky. The minute you diagnose breast cancer, you're going to lose your femininity by cutting off your breast. No, this is not done nowadays at all, unless until the presentation is a localized advanced disease where the cancer is spread to the skin, cancer is spread widely to the entire breast, where we cannot conserve the breast. So the surgery done for breast cancer is breast conservation surgery, where we see that the femininity is, that gives us so much of impact on a lady's mind. Imagine removing the breast. So it is a symbol of femininity for all the ladies. So no, breast mastectomy is done only for advanced cases. Again, here comes, if you want to conserve your breast, go for screening, which can detect the breast cancer at the earliest stage. So breast lumpectomy with a margin, with a clear margin of at least 0.5 to 1 centimeter all around, with lymph node removal. Lymph nodes are nothing but like filters, which filter the bad cells from the cancer. If it has spread to the lymph node, again it goes to stage 2, stage 3. So we do a lymph node dissection also, and then mastectomy, simple mastectomy, where we remove only the breast, and then modified radical mastectomy, where we remove the entire lymph nodes of the armpits and the entire breast. Again, this is not done frequently, it is done only for the advanced stages. And then Halsted mastectomy, which is a radical mastectomy, including the muscles removed, which is bygone days. It is not done nowadays. So the post-op recovery or going back to healthy life is very, very important, or normal life, which you can support yourself by doing meditation, yoga, and join the self-help groups and breast cancer survival group. These are the things which has to be done to rehabilitate a lady who has been treated and completely cured, but she'll be worried that will the cancer come back. So if you don't want to have any things affecting your normal life, go for a positive lifestyle, and that's it. Thank you so much.
Yeah, thank you, doctor, for a valuable speech. ஸோ எப்போ வந்து பிரஸ்ட் கேன்சர் ஸ்க்ரீனிங் பண்ணணும் அப்படிங்கிறத ரொம்ப கிளியராக சொன்னாங்க. லைஃப் ஸ்டைல் மாடிஃபிகேஷன் வந்து நம்மளுக்கு ரொம்ப முக்கியம் அப்படிங்கிறதையும் வந்து சொன்னாங்க வந்து. அண்ட் தென் என்னென்ன ஸ்டேஜஸில் இருக்கும், ஈவன் பிரஸ்ட் ரிமூவ் பண்ணவே தேவையில்லை, ஸோ அதுக்கு என்னென்ன நம்ம பண்ணலாம் அப்படிங்கிறதையும் ரொம்ப கிளியராக சொன்னாங்க. தேங்க்யூ டாக்டர். அண்ட் லெட்ஸ் ஹாவ் அ ஸ்மால் வீடியோ ஆஃப் ஹர். ஓகே ஓகே. Now let's call upon Dr. Shivaprakash Ratnaswamy, consultant, oncologist, Aster Hospital, Algeciras. He is going to talk about treatment and prophylactic procedures for screening detected cancer and hereditary breast cancer. He is expert in this field for a very long time. Dr. Shivaprakash. Fine.
Am I audible? Hello? Am I audible? Hello? Hello? Can you hear me? Can you hear me? Hello? IT group? Hello?
Hello. Yeah, can you hear us, doctor?
Yeah, no, I'm not able to hear. No, I can hear no one.
Can you
So
hear
am I
us now?
audible? Am I audible?
Yeah, now yes. Yeah. You
Yes?
can take it forward, doctor. Yeah.
Yeah, okay. Okay. Thank you. என் இனிய தமிழ் மக்களே, I am not hearing actually much from the audience, right? But I am audible, right? Reconfirm, please. Can you reconfirm I am audible? Hello?
Yes, doctor. Yeah.
Yeah, okay. I will proceed actually, okay?
Yeah, please go ahead, doctor. Yes, you can.
Yeah, okay. So I am in Chennai now. அதனால மற்றவங்களாம் ஜெலஸாக கூட இருக்கலாம், சார் மட்டும் அங்கே சென்னையில் உட்காந்து. ஸோ ஐ எம் oncologist in Aster Hospital, size in Mankul. And here also, Sharjah, we have not started oncology services. Soon we might start. இப்போ radiologist, oncologist, and the tools, எப்படி breast cancer screening I will tell you starts like 1 year of starting oncology service. So we have 1 year starting from August 2021. இப்போ வரைக்கும் 50 plus like plus patients, breast cancer alone patients வந்து already has been completed treatment and cured, declared cure, and they are survivors and they are following up, and more than 100 patients are getting treatment now. So this is the recent census. More than 150 patients we have, and 50 has been completed, because it takes 6 to 8 months if you have a treatment to start with, and nearly 100 patients are under treatment now. So they may be in post surgery, some are under chemo, and some are under radiation therapy. So they'll be finishing. So this is the census. So it is not like very uncommon. அப்படிலாம் கிடையாது. இங்கேயுமே ரொம்ப காமன். அண்ட் ஹாஸ்டர் ஹாஸ்பிட்டலில் மோஸ்ட்லி 90% 80% வந்துட்டு ஏஷியன் பாப்புலேஷன். அதுலேயும் வந்துட்டு மோஸ்ட்லி பார்த்தீங்கன்னா சவுத் இந்தியன் பாப்புலேஷன், அதில் தமிழ் பாப்புலேஷன் ஈக்குவலாக இருக்காங்க. ஹவு மச் கேரளா தமிழ்நாடு ரொம்ப ஈக்குவல் கான்ட்ரிபியூஷன் ஆஃப் தி பாப்புலேஷன். அதனால வந்துட்டு நம்ம வந்துட்டு வராது, நமக்கு சான்ஸ் கம்மி அப்படின்னு கிடையாது. அண்ட் வெரி ஃப்ரீக்வெண்ட்லி காமன்லி சி அட்லீஸ்ட் ஃபேமிலி மெம்பர்ஸ் யாராவது இருக்கிற மாதிரி. இது வந்து நாட் டு லைக் ஃபியர், பயப்படுற மாதிரி அதுக்காக இல்லை, பட் அட்லீஸ்ட் அவேர்னஸ்க்காக தான், மெயினாக அவேர்னஸ்க்காக. மெயினாக வந்து வி ஆர் நாட் டாக்கிங் அபவுட் லம்ப் இருக்குது, சேஞ்சஸ் இருக்குது வரணுன்றதுக்காக இல்லை. ஸ்க்ரீனிங் இஸ் அபவுட் நார்மல் பீப்புள் வென் யூ டோன்ட் ஹேவ் எனி சிம்டம், அவங்களுக்கு தான் ஸ்க்ரீனிங். வந்ததுக்கு அப்புறம் இட் இஸ் டயக்னோசிஸ் அண்ட் ட்ரீட்மெண்ட். ஸோ நம்ம ஸ்க்ரீனிங் யாருக்கு சொல்றோம்னா 40 இயர்ஸ்க்கு மேலே இருக்க நார்மல் ஆர் 40 இயர்ஸ்க்குள்ள ஹை ரிஸ்காக இருக்கிறவங்க. செல்ஃப் டெஸ்ட் எக்ஸாமினேஷன் ஓகே, அது வந்து ஒன்லி ஃபார் அவேர்னஸ். கைட்லைன்ஸ் படி செல்ஃப் டெஸ்ட் எக்ஸாமினேஷன் வில் நாட் கிவ் எனி மச் ஆஃப் சர்வைவல் அட்வான்டேஜ். பட் கிளினிக்கல் எக்ஸாமினேஷன் பை டாக்டரும் மேமோகிராம் எதர் அல்ட்ராசவுண்ட் ஆர் எக்ஸ்ரே வில் டெஃபினெட்லி கிவ் யூ ஒரு 18-20% சான்ஸ் ஆஃப் சர்வைவல் கம்பேர்ட் டு நாட் ஸ்க்ரீனிங். ஸோ ஸ்க்ரீனிங்கில் வந்துட்டு ஐடென்டிஃபை பண்ணும்போது இங்கே வந்து ரொம்ப கம்மியாக பார்க்குறாங்க. ஈவன் ஐ ஹவ் சீன் இன் இந்தியாவில், சென்னையில் கூட ஐ ஹவ் சீன் லாட் ஆஃப் பேஷன்ஸ் கம்மிங் ஃபார் ஸ்க்ரீனிங். ஸ்க்ரீன் டிடெக்டட் கேன்சர்ஸ் நாங்கள் பார்க்குறோம். இன்னுமே யூஏஇல ஸ்க்ரீன் டிடெக்டட் கேன்சர்ஸ் ஆர் வெரி லெஸ். பீப்புள் கம்மிங் வித் ஹியூமர் அண்ட் ஹையர் ஸ்டேஜ் நிறைய வராங்க. ஸோ ஸ்க்ரீன் டிடெக்டட் கேன்சர்ஸ்னா ஜஸ்ட் ஒரு கால்சிஃபிகேஷன் சொல்லுவோம், சின்ன சின்ன ஒயிட் டார்க்ஸ் இன் யுவர் எக்ஸ்ரேல தெரிஞ்சாலோ அல்ட்ராசவுண்ட்ல சேஞ்சஸ் இருந்தாலோ வி டூ அ பயாப்சி, நீடல் டெஸ்ட் தான். அதை ஐடென்டிஃபை பண்ணிட்டு கேன்சருக்கு முன்னாடியே டிசிஎஸ்ன்னு சொல்லுவோம், இல்லை அதுக்கு முன்னாடியுமே ஹை ரிஸ்க் நான் கேன்சரஸ் பினைன் ஸ்டேஜஸ் இருக்கும். அப்பயே வந்துட்டு ஒரு நீடல் மாதிரி அல்ட்ராசவுண்ட் மாதிரி ஆப்ரேஷன் டைம்ல அந்த அனஸ்தீசியாலேயே பண்ணி அப்பயே பயாப்சி மாதிரி எடுத்து அப்பயே கன்ஃபார்ம் பண்ணிடும். ஃப்ரோசன் செக்ஷன் வேர் ஃபெசிலிட்டிஸ் இன் ஆஸ்டர் ஹாஸ்பிட்டல் வேர் வி கேன் கன்ஃபார்ம் வெதர் இட் இஸ் கேன்சர் ஆர் நாட் டூரிங் ஆப்ரேஷன். 30 minutes 20 to 30 minutes வில் கெட் ரிப்போர்ட். அண்ட் இஃப் கேன்சர் ஆச்சுன்னா ஏற்ற மாதிரி அப்பயே ட்ரீட் பண்ணிடுவோம். அப்படி இல்லைன்னா அதோடையே மார்ஜின் எடுத்துட்டு விட்டுடுவோம். ஸோ மார்ஜின் கிளியர் ஆகான்னு பார்த்துருவோம். ஸோ அதனால வந்துட்டு இட்ஸ் ஈஸி டு கிளியர் இட். அப்போ வந்து கேன்சர் நேமே இருக்காது, இட் ஜஸ்ட் ப்ரீ கேன்சரஸ், அவ்வளோதான். உங்களுக்கு கேன்சர் சர்வே நேமே வராது ஆக்சுவலாக. ஸோ அது வந்துட்டு பெட்டர் தேன் ஹேவிங் அ கேன்சர் ஸ்டாம்ப். ஈவன் ஸ்டேஜ் 1 இருந்தால் கூட அதுக்கப்புறம் பயந்துட்டே இருக்க மாதிரி, ஸ்க்ரீனிங் வந்துட்டே இருக்க மாதிரி இருக்கும். அதுக்கு பெட்டர் டு கெட் ஸ்க்ரீன் அண்ட் ஏர்லி ஸ்டேஜில், ஸ்டேஜ்னு சொல்ல முடியாது, ப்ரீ கேன்சர் ஸ்டேஜ்லேயே வி கேன் ஐடென்டிஃபை. அதுதான் வி வாண்ட் ஆக்சுவலி. அண்ட் ஒன்ஸ் வந்துருச்சுனால இப்போ வந்துட்டு ஈவன் ஒன்ஸ் லிமிட் கீமோதெரப்பி எல்லாமே ஆப்ஷன் வந்துடும் ஆக்சுவலாக, டு பி ஃப்ராங்க். அதனால தான் வி ஆர் வெரி மச் பேங் ஆன் ஸ்க்ரீனிங். ஸ்க்ரீனிங் பண்ணி ஏர்லியரை கண்டுபிடிச்சிட்டா இந்த எதுவுமே இப்போ தேவையில்லை, யூ டோன்ட் ஹேவ் டு கோ த்ரூ. அதர்வைஸ் வந்துட்டு நம்ம கீமோ கொடுத்துருக்கலாமோ வேணாமோ, இல்லை டாக்டர் வேணான்னு சொல்லிட்டாரு, ஓகே இருந்தாலும் கொடுத்துருக்கலாமா, இல்லை இது போதுமா, பிரஸ்ட் எடுத்துருக்கலாமா வேணாமா, அவர் சொன்னாரு இது போதும்னு சொல்லிட்டு இந்த மாதிரிலாம் unnecessary தாட்ஸ் வர்றதுக்கு முன்னாடியே பண்ணிக்கலாமே. வந்ததுக்கு அப்புறம் டெஃபினெட்லி டோன்ட் ஹேவ் டு வரி. இப்போ இருக்க சர்ஜரிஸ்ல வந்துட்டு வி டூ வெறும் லம்பெக்டமின்னு சொல்லுவோம், அங்கே மட்டுமே எடுத்துட்டு டூரிங் சர்ஜரியே கன்ஃபார்ம். முந்தி மாதிரிலாம் கிடையாது, எடுத்ததுக்கு அப்புறமா திருப்பி மார்ஜின் பாசிட்டிவா இருக்கு திருப்பி நம்ம பிரஸ்ட் எடுக்கணும், இல்லை திருப்பி ஆப்ரேட் பண்ணணும், அந்த மாதிரி ஆப்ஷனே கிடையாது. ஆப்ரேஷன் டைமே எல்லா மார்ஜின்ஸ் கிளியர் பார்த்துட்டு தான் வி கம் அவுட். அண்ட் இன்னொன்று நீங்கள் நிறைய கேள்விப்பட்டிருப்பீங்க, பிரஸ்ட் சர்ஜரி பண்ணான கை வீக்கம் வரும். அந்த காலத்தில் மோஸ்ட்லி அம்மா அந்த டைம்லாம் பண்ணாங்கன்னா கை வீக்கம் வரும், அடிக்கடி வீங்கிக்குது. இதுதான் காமனஸ்ட்டாக இங்கே பார்க்குற காம்ப்ளிகேஷனாக இருக்கும். ரேதர் தான் பிரஸ்ட் எடுத்தது கூட யாரும் அவ்வளோ ஃபீல் பண்ண மாட்டாங்க, கை வீக்கம் வரதான் ஃபீல் பண்ணுவாங்க. அதனால ரீசெண்டாக 20 இயர்ஸாகவே இருக்குது. அண்ட் டெஃபினட்டாக இங்கே இருக்க 5 இயர்ஸ் யூஏஇல நான் தான் ஃபாலோ பண்ணுறேன். இப்போ ஆஸ்டர்லையும் சேம் சென்ட்ரல் நோட் பேப்சின்னு சொல்லிட்டு வி டோன்ட் ரிமூவ் தி லிம்ஃப் நோட் கம்ப்ளீட்லி. ஏர்லி ஸ்டேஜாக இருக்கும்போது நோடு நெகட்டிவாக இருக்கும்போது 80% சான்ஸ் கிளினிக்கலாக இருந்தலைன்னா அங்கே பரவி இருக்காது. நெறிக்கட்டி பரவலைன்னா தேவையில்லாமல் கிளியரன்ஸ் பண்ணோம்னா கை வீக்கம் குறைக்கலாம். 20% சான்சஸ் எப்பவுமே பண்ணால் ஆக்சிடென்ட் டிஃபெக்ட் பண்ணால் இருக்கும்னு சொல்லிட்டு இன்னும் லைஃப் டைம் எப்போனாலும் வரலாம். அதுக்கு பதிலாக ஒரே ஒரு லிம்ஃப் நோடில் 2 லிம்ஃப் நோடு மட்டும் அந்த ஃபர்ஸ்ட் ஸ்டேஷன் லிம்ஃப் நோடை எடுத்து டூரிங் ஆப்ரேஷன் கன்ஃபார்ம் பண்ணிட்டு தான் வி ஆர் டூயிங் ஆக்சுவலி ஏர்லி ஸ்டேஜ் எல்லாமே. அதனால பார்த்தீங்கன்னா கிட்டத்தட்ட 80% நெகட்டிவாக தான் இருக்குது, ஒன்லி 20% தான் அது பாசிட்டிவாக வருது. அப்போ தான் நம்ம கிளியர் பண்ணுறோம். அப்படி இல்லாட்டி மோஸ்ட் ஆஃப் தி ஏர்லி ஸ்டேஜில் 80% கேன் அவாய்ட். எப்படி சர்ஜரினா காலையில் பண்ணிட்டு ஈவினிங் ஆர் நெக்ஸ்ட் டே மார்னிங் யூ ஆர் கோயிங் ஹோம். ஈவன் அது வந்துட்டு பிரஸ்ட் எடுக்கிற சர்ஜரியாக இருந்தாலும் சரி, இல்லை இந்த மாதிரி சிம்பிள் சர்ஜரியாக இருந்தாலும் சரி. சில சமயம் வந்துட்டு ஏர்லி ஸ்டேஜில் வி ஹேவ் டு ரீகன்ஸ்ட்ரக்ட். யங் பேஷண்டாக இருந்தாலும் they want to reconstruct, we are doing reconstruction with the bone tissues or with the implant or silicone கூட இருந்தால் 2 days they will go home and surgery is not a big deal. and it's only a psychological issue. அதனால தான் வந்துட்டு we are telling breast எடுக்கிறதுக்கு முன்னாடியே early stage if you come back, come to us, and it is easier to conserve the breast. Even if it is more also, இப்போலாம் வந்து கீமோதெரப்பி கொடுத்து இந்த கிளிப்ஸ்லாம் போட்டு கீமோதெரப்பி கொடுத்து ஃபுல்லாக அதை ரெடியூஸ் பண்ணி 70-80% சான்சஸ் ஆஃப் கம்ப்ளீட் ரெஸ்பான்ஸ் இல்லாமே போயிடுது, டியூமரே இல்லாமல் போயிடுது. ஸோ அந்த டைமில் எதர் வி ரிமூவ் ஒன்லி தி ஏரியா விச் இஸ் மார்க் ஆர் வி ரிமூவ் தி ஹோல் பிரெஸ்ட் வித் ரீகன்ஸ்ட்ரக்ஷன். ஸோ இந்த ஆப்ஷன்ஸ் எல்லாமே நாங்கள் கொடுக்குறோம். அண்ட் எல்லா பேஷண்ட்ஸுமே எடுத்துக்கிறாங்க, நாட் லைக் ரொம்ப ஏர்லி 30-40s இல்லை, 50-60s கூட டேக் தி. ஏன்னா இங்கே மோஸ்ட்லி யூஏஇல ஆர் ஒர்க்கிங் விமன், ஹவுஸ் ஒய்ஃப்ஸ் ஆர் ஆல்சோ தேர், பட் ஸ்டில் வி ஹேவ் தி ஆப்ஷன்ஸ். Everybody will always ask for the options and they are preferring conservation or reconstruction. இது வந்துட்டு இது மாதிரி இல்லை, முந்தி மாதிரி இருக்க சுச்சுவேஷன் இல்லை. இப்போ எல்லாமே சேஞ்ச். ஈவன் இன் இந்தியா ஆர் இன் யூஏஇ இட்ஸ் ஆல் சேம் சுச்சுவேஷன் ஒன்லி. ஸோ அதனால ஆன்காலஜிஸ்ட் I insist on annual screening after 40 years and less than 40 years அப்படின்னா if you have a high risk, consult doctor. And doctor வந்துட்டு examination yearly once or 6 months once according to your higher risk strategy. அதுக்கப்புறம் மேமோகிராம் எடுத்துக்கோங்க. யங் ஏஜ்னா அப்படின்னா they will suggest whether you want ultrasound or MRI, they as per the guidelines as people told before, doctors told before. And அதுக்கேற்ற மாதிரி பண்ணணும்னா we can definitely get down the numbers. And நான் அதிகமாக பார்க்குறோம். And it's not like we are not happy actually getting patients to number of patients to see actually. We want more patients to come with awareness. And the patients எல்லாமே வந்து பாசிட்டிவ் வரும்போது எல்லாமே பைராக்ஸ் 4-5 ஹார்ட் கேட்டகரைசேஷன் இன் அல்ட்ராசவுண்ட்ல ஆர் மேமோகிராம்ல அந்த 4-5 வரும்போது வி ஃபைன் லைக் ஏர்லியா இருக்கும்போது வி ஆர் வெரி ஹாப்பி, லைக் இந்த டைம்ல எடுத்துடலாமே பெட்டர்னு சொல்லிட்டு. பட் அவங்களாம் லேட் ஸ்டேஜா வரும்போது பெருசா இருக்கு சார் நான் பார்க்கல. நாட் ஒன்லி ஒரு ஹவுஸ் ஒய்ஃபோ இல்லை ஓல்ட் ஏஜ்லாம் கிடையாது, எஜுகேட்டர், ஈவன் டாக்டர்ஸ் அண்ட் ஆர் பீப்புள் இன் அ ஹை கேட்டகரி லைக் ஜிஎம், அவங்க கூட they are coming with 4-5 centimeter பெரிய லம்போட தான் வராங்க. So telling like I just thought it is a normal changes, it will go off அப்படின்னு சொல்லி. ஸோ இது வந்துட்டு இன்னுமே அவேர்னஸ் வரணும். And even the doctors who are sitting and the people who are sitting in the audience side, if you are 40, definitely it's not like doctors வராதுன்னு கிடையாது. And male breast cancer also. இப்போ 100 breast cancer of patients எடுத்தோம்னா அது 99 ஃபீமேல்னா ஒரு மேல் இருக்காங்க ஆக்சுவலா. And we last year when we are presented for the opening ceremony அப்போ கூட ஒரு male breast cancer survivor தான் he came, like when we were treated in UAE only. He came to open up his words and all. So அதனால வந்து male breast cancer also is there actually. But definitely female after 40 you have to screen. And anything we are there actually. And we have full of like out mari I'm there actually as a man actually as an oncologist, but we have full of team like staff members all females only, and they are full support for the oncology team. Even என்னோட இதுல வந்து என்னையும் என்னோட மெடிக்கல் ஆன்காலஜிஸ்ட் தவிர all people 99.9% are all female staff only, starting from nurses to technicians ல இருந்து ward nurses ல இருந்து OT staffs ல இருந்து எல்லாருமே will be taking care of this. And we have special team for oncology also for managing and all, and operations team also. Thanks for the ASTER groups to have this speech. And I missed Sharjah. I have not visited yet, and I hope I will visit next month. I think. Thank you.
Yeah, thank you, doctor. Thank you, doctor, for your valuable speech. ஸோ பிரெஸ்ட் கேன்சருக்கு வந்து ஆங்காலஜி அது வந்து எவ்வளோ இம்பார்ட்டண்ட், அதுக்கு எவ்வளோ சப்போர்ட் வந்து நம்மளுக்கு பிரெஸ்ட் கேன்சருக்கு வந்து தேவைப்படுது அப்படின்னு டாக்டர் சொன்னாங்க. தேங்க்யூ டாக்டர்.
Thank you for the webinar, and thank you doctors for explaining everything. And it's a great help, and it is a lot of important questions. We got the clarifications. Thank you so much. எல்லாருக்கும் புரிஞ்சுதா? இம்பார்ட்டண்ட்டாக இருந்துச்சா? யூஸ்ஃபுல்லாக இருந்ததா? இந்த மார்னிங் உங்களுக்காக யூஸ் பண்ணிங்களா? ஹாப்பியாக இருக்கீங்களா? நிறைய கொஸ்டின்ஸ் இருக்கா? இல்லை பசிக்குதா? ஓகே, கொஞ்சம் கொஸ்டின்ஸ் இருக்குது. ஸோ கொஸ்டின்ஸ்க்கு ஆன்சர் டாக்டர்ஸ்ட்டை கேட்டுக்கலாமா? உங்களுக்கு தமிழில் பேசணுமா டாக்டர்? ஷுவரா? ஓகே டாக்டர்ஸ், first question, can you please explain in detail the procedure as how can we examine ourselves whether any lump is there in our breast? Thank you, Doctor.
Yeah, my topic.
I think this I answered during my talk. If you want a demo, you can meet any gynecologist here in Aster Sharjah for your examination. At least you should all do a clinical examination at least now in the October month, and doctor will also show you how to go for self-breast examination. As I told you, it has to be done between 8th to 10th day of the cycle, both in sleeping position as well as sitting position, and both has to be done at the same time. If you consider the breast as a clock, we take it as 12 and 6. So the left breast, the left outer half is like this, if you take it like a clock. So outer upper, outer lower, then inner side, inner upper, inner lower, then central quadrant, which includes the nipple areolar area and the armpits. So it's better to examine with the arms elevated with the opposite hand for the right breast with the left hand and left breast with the right hand. So when you visit your clinical doctor, maybe you can ask her to show you how to do it and demonstrate it to you. And in the end, you can also press alongside of the nipples in 1 to 12 o'clock direction to see if there's any discharge coming out. And also look yourself in the mirrors to see any skin changes. I think this point I did not say when I was talking. To look for skin changes. The skin changes which warrant you to visit a doctor immediately is like puckering or withdrawing of the nipples, which gets retracted inside. Again here I want to tell something. See, some ladies will have retracted nipples from like adolescence. It's very normal. And they don't have a prominent nipples, it's always retracted inside. That's normal. Any recent retractions, like last month it was not there. This month you observe that the nipple is retracted inside. That's an important sign. And then bleeding from single nipples, and then the pudgy orange. The breast skin looks like orange peel, which says that there's some hardening. Also when there's infection, you get this pudgy orange, but whenever you feel this redness, see, in inflammatory cancers, the cancers associated with inflammation, it has this redness and pudgy. Otherwise, non-inflammatory cancers, you have only the thickening of the skin with puckering and retraction of the nipple and the skin of an orange, like the dots, which is because of the lymphatic duct blockage, which drains the skin. So these things are important when you're doing a monthly self-breast examination. That's very good, madam. Yeah, madam has put a very nice slide which tells about how, whatever steps I explained to you. You have to look at it at a mirror or look at both breasts by bending down your head. Then by examination, by palpating, both lying down and standing or sitting position. Maybe you can go through the slides. Is it visible to the people who are sitting in the end? Okay. Thank you.
Thank you, doctor. Sangeeta, you got answer? When is the right time to pre-examine the breast for women within 50 plus years? What age? 50 plus years.
That's a good question. Yeah, I missed it because I was hurrying. I was thinking I'm taking other doctors' time. So menopause, yeah, that's a very good question, very thoughtful question. See, if you have a regular period, so before menopause, it has to be done between 8th to 10th day. Menopausal age group, keep a day, single day in the first date. First of month, second of month, third, or your birthday. Like if your birthday is on 20th of every month. Again, only once a month, not daily. Once a month is more than sufficient. Fix a date and do it on the same date every month.
Thank you, doctor, again. Sonia, you got answer? Thank you, Sonia. Will lump nodes leads to cancer? If one have lump nodes, how frequently they should have clinical tests?
Yeah, this is again frequently asked question by my patients. Lymph nodes in the armpits are very, very common. 90% of us will have a enlarged armpit nodes when you scan ourselves, when we scan ourselves. This is because of the hair follicles which gets infected, which gets bruised, and when you, even sweating, when you start itching, and waxing, which is done by all of us, waxing also can give rise to lymph nodes because it causes small rashes in the skin. And axillary lymphadenitis is a very, very common, I can say, normal finding in breast ultrasound. And the radiologist, our radiology friends, will tell us whether it is a non-specific or there is a feature in the lymph node. I think doctor will explain to you. Just tell them in their terms so that they understand. If the radiology doctor mentions that this is a scary lymph node, then of course it is important and we have to follow up like yearly or 6 monthly basis for that lymph node. But if they say non-specific lymphadenitis, it's a very common finding. We have a very intelligent, and that means they are listening to us very nicely. Really, very good questions. Very good audience.
Yeah, in ultrasound, most of the time that lymph node we see in the both axilla, but benign lymph nodes like it's inside the hilum is there, that cortical thickness is less than 3 mm. When the hilum is not seen, vascularity is more, cortical thickness is more than 3 mm, then we see that it is a suspicious node, and then we mention in the reports also. Like that.
So basically, if you see any lump under your armpit, you have to get it evaluated. So it is also part of your breast tissue. That is the message we want to give you.
Thank you, doctors. Shanas, you got an answer? Thanks. Is there a possibility of breast cancer to fight the person again who has went through the stage 2 of breast cancer? It is curable? Is there a possibility of breast cancer to affect the person again who has went through the stage number 2 of breast cancer? Is it curable?
Relapse. So this is called as a relapse of the breast cancer. Of course, that's why we do annual screening for survivors who have, see, the oncologist will declare that you're cured. And Dr. Shivprakash is there online, or he's there. So he can also answer this question better than me. So the main thing is, the screening, even after curing the breast cancer, there is definitely chance of relapse, not only in the other breast. If other breast is, if the one breast is cured completely, other breast can get another new cancer, not relapse. So screening is very important for checking. Yeah. He's there. Yeah. Dr. Shivprakash, you want to tell anything about this question? You want to add anything? I think you have to unmute, doctor. I think you're muted. Oh, we have to unmute. Yeah. It's done? It's just a few seconds, doctor. Yeah. It's done?
Meanwhile, ask them a famous Tamil personality. Meanwhile, can you tell me a famous Tamil personality who is a breast cancer survivor? Very good. Very good. Who is it? Gautami. Gautami? Yeah. Kamala Hassan's ex-girlfriend. Ex. Yeah.
Yeah, doctor, can you hear us now? Can you just give us just a check? Just say a word, doctor. No. But no, we are not able. It's there. Okay, doctor, just give us some time because there is some technical audio issues are there. We are trying to figure it out from the back end. So, meanwhile, do you have any other questions for the panelists right here?
Any questions? Yes, please.
Hi, doctor. It's not about particular breast, but in common cancer, they tell hair coloring and dyeing may cause cancer. Is it true?
Hair coloring, hair dye.
Actually, any chemicals used on the skin. See, hair dye we are using directly on the skin. Even though we are using to the hairs, we are touching the skin, the scalp skin. Yes, of course it is a carcinogen, but a very, 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 very rare to... I have not seen a single cancer caused by hair dye in my 21 years of practice. So, I don't think we should all stop dyeing, hair dyeing because of that risk. Actually, it's not, there's no evidence to show that it causes skin cancer, but it comes under the group of carcinogens. You know, all chemicals come under the group of carcinogens. So, but it's not as strong as the, dyes used in some industries where the workers, for example, bladder cancer, out of, there's no doubt that it happens in people who work in dye industry, industrial production. It's proved beyond doubt. Nothing is proved like that for hair dyes. Okay, thank you.
But does ammonia-free help?
No idea at all.
Thank you so much, doctors.
So yeah, thank you so much, doctor. I guess doctor அவங்களே சொல்லிட்டாங்க that நீங்க வந்து ரொம்ப intellectual-ஆ இருந்திருக்கீங்க, நல்லா listen பண்ணிருக்கீங்க, questions கேட்டிருக்கீங்கன்னு. So I'm really happy for it. Yeah, you have a question?
Okay. Can I ask in Tamil? Yeah. ஆக்சுவலி என்னோடய ஃபஸ்ட் பேபி பிறந்தப்போ கொஞ்சம் ஹெல்த் இஷ்யூஸ் இருந்தது. ஸோ குழந்தைக்கு வந்து அபவுட் 3 to 4 months வந்து நான் மிஷின்லேருந்து தான் ஃபீட் பண்ணேன், பாட்டிலில் எடுத்து. ஸோ அப்போ டாக்டர்ஸ் எல்லாம் என்ன சஜஸ்ட் பண்ணாங்கன்னா, இப்படி பண்ணால் ஃப்யூச்சரில் வந்து பிரஸ்ட் கேன்சர் வர்றதுக்கு சான்சஸ் இருக்குது அப்படின்னாங்க. ஸோ அந்த த்ரெட்னிங் வந்து எனக்கு இன்னும் இருக்குது, அது அந்த மாதிரி இருக்குமா வருமா அப்படின்றது. யா,
நீங்கள் மிஷின்னு சொல்லப்போ பிரஸ்ட் பம்ப் தானே யூஸ் பண்ணினேன், எலக்ட்ரிக் பிரஸ்ட் பம்ப் தானே? நோ, இட் டசன்ட்.
No way it's related to the, breast cancer chance. Yes, maybe they wanted mother to encourage the breastfeeding. Again, this I didn't highlight during my talk. Breastfeeding is very, very, very protective. They say 2 to 3 years of breastfeeding is very protective against breast cancer. So breast cancer is seen more in nulliparous, in those who don't beget children, and in those unmarried ladies. And in those ladies who get early menarche and late menopause. Again, this is because of estrogen exposure. In pregnancy, there's one hormone called estrogen which gets inhibited. When this hormone is inhibited, that means breast cancer risk is gone. So even when you're breastfeeding, this estrogen is inhibited. So the risk is almost gone for 3 years. Means you are not like hair dyes. You said you are exposed to carcinogens every 4 weeks. But here, 3 years, you are not exposing to the risk of estrogen. That's how. And maybe if you use the pump, what we do, most of the working ladies, they pump out the milk and keep it in the bottle. Maybe to encourage the breastfeeding, they say like that. So as it is protective against breast cancer, but breast pump itself doesn't cause any breast cancer. Okay, thank you.
I have a question for the audience. So, if we find a lump in our breast, whom should we go to? The cancer surgeon, the GP, the gynecologist, or the general surgeon? That is why I asked you the question, because I want to highlight that all breast conditions which require inspection, your investigations, as well as surgery, is actually dealt by the surgeon, the general surgeon. Though we gynecologists are the ones you as women are more familiar with and you would come to us, we would ultimately be referring you to a general surgeon. So whenever you find yourself with any breast conditions, you are always free to discuss it with your gynecologist, but the ultimate specialist in this is the general surgeon, right?
Thank you, doctor. Thank you so much.
Yeah. So now just put it in a nutshell. I'm just going to tell it in or ரெண்டு மூணு pointsல we can summarize this. So yeah, I hope இப்போ எல்லா presentation நீங்கள் அவங்க சொன்னது எல்லாமே உங்களுக்கு ஞாபகம் இருக்குன்னு நான் நம்புகிறேன். So yeah, just keep remembering that 25 yearsக்கு அப்புறமா please do your screening every month. உங்களுக்கு அந்த presentationல காமிச்சாங்க எப்படி வீட்லயே நம்ம self screen பண்ணலான்னு. Please keep a calendarலையோ இல்லை உங்கள் மொபைல்லையோ கேலண்டர் வச்சுக்கோங்க, ரிமைண்டர் வச்சுக்கோங்க. பிகாஸ் வி நோ நம்ம நிறைய மல்டிடாஸ்க் பண்ணுறதுல வி ஆர் த லீஸ்ட் ஆஃப் டேக்கிங் கேர் ஆஃப் ஆர் செல்ஃப். வி புட் அதர்ஸ் இன் ஃப்ரண்ட் ஆஃப் அஸ் அண்ட் யூனோ நம்மளை பார்த்துக்கவே மாட்டோம். ஸோ ஜஸ்ட் ரிமெம்பர் தட் ஆஃப்டர் 25 years எல்லா விமனையும் ப்ரீ ஸ்க்ரீன் பண்ண சொல்லுங்கள் வீட்லேயே. அண்ட் அவங்க ப்ரெசன்டேஷனில் சொன்ன மாதிரி அந்த ஸ்டெப்ஸ் எல்லாம் மைண்டில் ஞாபகம் வச்சுக்கோங்க. சேம் வே post monopism, make sure that monthly once you do fix a date and do it. And of course breast removal pathina or awareness ipo generally nariya vandandrukku. So just make first neenga dhairiyama irunga. As doctor said, breast removal is not necessary for every cases. It's just depend on the case to case basis. Abdi vandalume we can be, you guys are bold enough to face it. Okay, so yeah, and more than about it, vitamin D இப்போ as doctor said இப்போ அது புதுசா வந்துருக்கு இல்லையா. So just make yourself that you do a regular body health checkup so that உங்களுக்கு இந்த vitamin problems என்ன இருந்தாலும் அதில் டிடெக்ட் ஆகும். So yeah, it's a wonderful session, doctor. Thank you so much each and every other panelist who are here, and thank you audience for being so lively and so interactive. Okay, so now the final finale of the event. We're gonna launch we are going to launch a card. So that is with help of Aster volunteers and WIT. And the card என்னன்னு பார்த்தீங்கன்னா a breast screening privilege card of 2022. So now அந்த கார்டை நம்ம launch பண்ணுறதுக்கு I would like to Mr. Gaurav to be on the dais and Dr. Danu to be on the dais, and other panelists also please join the thing. And I would also like to welcome Ms. Merlin Gopi, the President, and Abhinaya, the Vice President. Do you want to add anyone else? Yeah, okay. Yeah, please, committee members alone join the group so that we will inaugural the card for this year. Yeah. So, Merlin, yeah. So in the card order details எல்லாமே உங்களோட president and the vice president will explain you. So அதுக்கேற்ற மாதிரி நீங்கள் வந்து அந்த services avail பண்ணிக்கலாம். So once again, thank you so much of the people who are there in the dais. So now. Yeah, they have taken this. Sir, you also. We want you also to join. Yeah. So one group picture. So yeah, now Mr. Gaurav, the COO of Aster Hospital Sharjah, will tell about the importance of this privilege scheme.
Good morning all. Thank you for coming on a Saturday morning, and thank you Mr. Jaleel and Aster volunteers for arranging this program, and thank you for the Tamil Association WIT. It was a very informative session even for me, as a male, And as somebody who's worked in healthcare for 15 years, I'm sure you all have gained an insight into best awareness and how to take care of yourselves and your families. I thank the panelists for taking out time and talking to you. And I really appreciate all of you coming to Aster Sharjah and giving us an opportunity to speak to you. Just to give you a background of Aster Sharjah, it's the second hospital for Aster DM Group in Sharjah. We have a Medcare hospital last 5 years ago on the King Faisal Street. This hospital is brand new. We did a grand launch 2 days before on the 19th of October. It's a 100-bed facility, state-of-the-art, with 4 operating theaters, 7-bed ICU, 7-bed NICU, and all the specialties, 20+ specialties. And we have majority doctors from India, Kerala, and Tamil Nadu. So you're most welcome to have a round of the facility. And for anything you need, this should be your destination to go. And we are there to help you and take care of you. Thank you.
Thank you, Mr. Gaurav. Now we are going to call upon Dr. Danu Chandradas, specialist in abs and gynecologist, Aster Hospital, Sharjah. She is expert in normal and high-risk pregnancy and laparoscopy surgeries. She is going to tell about the impacts of breast cancer. Yeah, doctor.
Hello, good morning everyone. I'm Dr. Danu Chandradas, specialist here in Aster Hospital, Sharjah. I take this opportunity to welcome each one of you to our Aster Hospital, Sharjah. So this is the month of October, the Breast Cancer Awareness Month, the Pink Month. So why do we dedicate a whole month to this breast cancer, just one disease? You all know you can get cancer anywhere in your body, be it brain tumor, eye tumor, your mouth, tongue, lungs, bones, muscles, liver cancer, stomach cancer, intestinal cancer, uterus, ovary, anywhere. But why do we dedicate one whole month to just a breast cancer? Okay, so what I want to tell is the impact of breast cancer in our society. According to WHO, the breast cancer is the most common cancer globally, and it is accounting for about 12% of all the new annual cases of new breast cancers detected. And in 2020, there were 2.3 million women diagnosed with breast cancer. As of the end of 2020, there were 7.8 million women globally who are alive and who are being diagnosed with breast cancer in the past 5 years, making it the world's most prevalent cancer. About 82% of breast cancer diagnoses each year are among the women aged more than 50 years. And it is estimated that about 30% of newly diagnosed cancers will be breast cancer. And it's said that the United States has done a survey, and they have concluded that the lifetime risk of a woman getting a breast cancer is 1 in 8. So like in the first row there is 8 women, one of you can get breast cancer in your future. So that is the impact of breast cancer. And in England and Wales, they have done a survey, and they have concluded that 1 in 12 women can get breast cancer. So that is the most common cancer a woman can get, and you should be aware of the possibility that you can get. And some say that with a family history of cancer you can get cancer. That is true, but regarding to breast cancer, the family history has little bit effect on the probability. About 90% of breast cancers are due to genetic abnormalities, not from the heredity, but due to the aging process and the lifestyle that you follow. Being obese, being diabetic, and alcohol consumption, lack of physical exercise, smoking, everything will cause genetic mutations. And age also has an important factor. So don't just believe that if you don't have a family history of breast cancer, you are least prone to get cancer. But if you don't have family history, and if you are obese and follow a bad lifestyle, you can get breast cancer. So coming to the deaths, breast cancer remains the second leading cause of death due to cancer among women, first being the lung cancer. So it is the most common cancer a woman can get, and that is the second most common cause of death in women. In 2020, there were about 685,000 deaths from breast cancer globally. And in 2022, it is estimated that 43,000 women and 500 men will die of breast cancer. breast cancer, the awareness, public awareness is brought into issue just to save life. And the month of October is celebrated as the breast cancer awareness to make public awareness about the impact of the disease in the society, how the early detection and the different modalities of treatment are there for a complete cure of the disease. So from 1989 onwards, there has been increased awareness among the public, different types of modalities of treatment, early detection by self-breast examination, ultrasound, mammogram, etc. And they have made it possible to decrease the mortality rate of breast cancer. In total, the death rate dropped by about 43% during the last few years due to the public awareness and the early detection and treatment. It can cause social impact, psychological impact, economical impact, everything. So those who are having cancer, about 38% of cancer patients are identified with anxiety, depression, distress, adjustment disorders, delirium, etc. And not only the patient will be suffering, the whole family will be suffering. And due to the diagnosis of the breast cancer and due to the economic impact that can have in that family, some of the relatives might back off from that family also. Okay, fearing that they might have to give potential economic support to that family. So they will be little bit pushed away from the society. So that can affect their mental health. And if you or someone you know, you care about, has been diagnosed with cancer, one promising way to relieve the psychological stress is to strengthen the social support, give them help mentally and economically also. Breast cancer can have a huge economic impact both in the society and for the patient and for the family members. According to a US study, about $16.5 billion is the total annual medical cost of breast cancer care. And about half of the breast cancer patients were diagnosed in 30s and 50s who are the working class women. So that has put a much strain on the economic thing in the society. And breast cancer has the highest treatment cost among all the cancers. And 13% of all the cancer treatment cost in USA is spent just for the breast cancer. And even though you have insurance, you will have to put on a lot of economic thing into the treatment of the breast cancer. And in USA, it is estimated that those who have even insurance, they have to put around $5,800 out of their pocket just for the treatment. And most of the patients will be losing their job or they won't be able to work as before. So that will be leading to more strain. Next. And like the other, my colleague said, breast cancer does not affect only the women. It can affect the men too. And in men, it is more worse than females. Okay. So less than 1% of all the new breast cancer patients occur in men. And as American Cancer Society estimates that each year about more than 2,000 men are diagnosed to have invasive breast cancer. That is a bad cancer. So make aware about your husbands also that they can also have breast cancer. But the probability is less compared to female. But when it comes to men, the prognosis is too bad. This is just a slide to show the new breast cancer cases and deaths among women that is done in USA. Less than 40 years age, there has been like 2 to 4% of cases of new breast cancers and 3% death. And when it comes to around between the age of 60 and 70, the percentage rises around 30%. And the death rate also comes to around 24%. Next. And the breast cancer, you can actually prevent it by following a normal lifestyle, like a healthy lifestyle. Eat only healthy food, avoid junk foods. Even though you are lean, you have to exercise at least 45 to 60 minutes in a day, 5 hours in a week, 5 days in a week. Okay, so that will help you out to prevent the breast cancer. And breast self-examination, as my colleague has told, you have to do it monthly. For menstruating female, it should be done between the 8th and 10th day of the cycle, and those who don't have their periods, they have to do every first of their month. Okay, So by self-breast examination, you can find out a lump. If that you have any doubt in you or your sisters or your daughters or anyone, even your husbands, get it checked with the surgeon. Okay. So that is the importance of celebrating this whole month as Breast Cancer Awareness Month. Thank you.
Thank you so much for this wonderful insight, Doctor. So I hope the audience are clear about it. And you guys have any questions? You have one question, yeah.
Yeah, hi ma'am. Actually, I have a question. After my delivery, while I'm feeding my doctors. Hi ma'am, I have a question. After my delivery, while I'm feeding my son, due to some personal reasons, forcibly I stopped him feeding around 6 to 8 months. So many of the people told if you stop feeding, you may get future breast cancer because the milk will be inside your breast. It won't completely child won't get feeding, so that I may get any possible due to breast cancer. Because I heard that many of the persons told like that.
No, that is totally not true. Just because you stop breastfeeding, you won't get breast cancer. Just because you don't breastfeed also, you won't get breast cancer. It is just that breastfeeding is protective, but in between your breastfeeding, you are worried because you stop, then the milk is getting clogged in your ducts and that can lead to cancer, right? That is not at all true. So don't worry about it. Yeah.
Thank you, Doctor. So yeah, we have one special performance from Miss Manjali. Can I call her on stage? Yeah.
சிறகுகள் வீசி சுதந்திர ஆசையில் போகிறேன், நான் போகிறேன். உலகத்தின் ஓசையில் புது ஒளி வீசிட போகிறேன், நான் ஆசைகள் எல்லாம் எனக்கென கொண்டு, மீசைகள் எல்லாம் கனவுகள் கண்டு, பொறுப்புகள் தேடி பயணங்கள் என்று, செருப்புகளே சிறகுகள் என்று போகிறேன், நான் போகிறேன், போகிறேன், நான் போகிறேன், போகிறேன், நான் போகிறேன், போகிறேன், நான் போகிறேன்.
That was really beautiful, really, really, really beautiful. Thank you so much, Miss Manjali. So yeah, last but not the least, I welcome Ms. Abhinaya Babu, the Vice President of WIT, to give the vote of thanks.
Thank you, Pavitra. Wow, what a session it was. Finally, we come to an end, and I would like to end this program with thanking all the doctor panels who are presented here. Thank you, Dr. Ankita, Dr. Varsha, Dr. Geeta, and Dr. Danu, and Dr. Sivaprakash, who joined us online. Thank you, all of you, for such a great awareness, and we have got a lot of takeaway from this. Apart from this, I would like to call Pavitra. So she's the one who was coordinating the entire event. She's very hi. So yeah, she's a senior HR in Aster, and to honor her, Priya Sham, please come over here. Thank you, Pavitra, for organizing. And one more special person is Eldo, sir, please come over here. And Kavita, please come. He managed the entire event, and he's the assistant manager in business development. Thank you, sir, for organizing. Thank you, thank you. And thank you, Mr. Gaurav, for being here and allowing us to conduct this. And thank you, Suresh, sir, for organizing this. And Mr. Jalil, thank you. The head of CSR, thank you so much. And of course, WIT members, thank you all. Thank you, the committee. And thank you for being here, listening patiently. I hope all your questions is answered. So we'll end this event with the refreshments, which is being arranged over here. We want committee members to help us. And then followed by the screening. Yes, so I think we'll wind this up. Yeah, so please help yourself for the refreshments. Thank you, thank you.